Infection with which of the following microorganism may result in clinical response resembling of the achalasia of the esophagus. That means achalasia of the esophagus caused by which of the microorganism. So achalasia, that means the achalasia cardia. What happens, what is the mechanism in achalasia cardia? Actually here the nerve ganglion absent from the muscle. That means the ganglion of the nerve, they are absent from the muscle layer. For this condition there is no motility or absent motility, and this ganglion may be present congenitally. That means from the ganglion absent even before birth, and when the patient gradually developing, and ultimately there is a development of the achalasia cardia. But sometimes some infection or some microorganism also can destroy the ganglion in the muscle layer of the esophagus also. So we have to find out the name of this microorganism. Here the options are the Epstein-Barr virus, Wuchereria bancrofti, Candida species, Trypanosoma cruzi, and a Helicobacter pylori. So first of all, see the Trypanosoma cruzi. This is a protozoa and it causes the Chagas disease. So the Trypanosoma cruzi, it causes the Chagas disease, and it is carried by the bugs and infect the skin whilst the feeding, and it penetrates through the open wound and mucous membrane also, and it causes intracellular proliferation. So it is a parasite. Then this parasite, it enters into body by different route, including the penetrate open wound and mucous membrane, and finally goes within the cell and causes the replication within the cell, or causes the increase their number within the cell. And the major infected site of the Trypanosoma cruzi, they are the CNS, that means the central nervous system, intestinal mesenteric plexus, that means the muscle plexus, nerve plexus present in the muscle, spleen, lymph node, and cardiac muscle. And the intestinal mesenteric plexus, it also affects the esophageal mesenteric plexus. And if the disease is chronic, in this condition it is irreversible. That means when this Trypanosoma cruzi can destroy the nerve, there is no possibilities to regeneration of the nerve. And this is the usual treatment in case of acute infection, which is the nifurtimox. So nifurtimox is used for the acute infection, but when it is chronic, that means destruction of the ganglion, in this condition the reversible is not possible. And this infection with Trypanosoma cruzi, it may cause destruction of the ganglionic cell of the mesenteric plexus, and final development of the achalasia, that means the loss of movement of the esophagus. And what is the clinical feature? At first the liquid content is not possible to deglute, and finally both liquid and solid. So what is the organism is responsible for achalasia of the esophagus? It is the Trypanosoma cruzi, not other things. It is the Trypanosoma cruzi.